To cut or not to cut? That is the question for most of the world's population. But for the people in Central Asia, it's rather a requirement than a question. Central Asia is well known for its large Muslim population, where Islamic traditions are kept and cherished. Male circumcision is one of the oldest of such traditions, which had been associated with cultural and religious significance. Kyrgyzstan is no exception in this case. In fact, if to refer to male circumcision global trends, Kyrgyzstan is included in a number of states that have high prevalence of circumcised men. It's no wonder, as the procedure was and still is considered to be part of a religious ritual and long-standing tradition. Yet, the operation is not always beneficial and comes with many dismal outcomes. Surgical risks such as bleeding, penile damage, local infection, emotional and psychological after effects are the issues that demand suitable remedies. So what is male circumcision and how does it look like? In simple words, male circumcision is a surgical removal of the skin that covers the tip of the penis. This foreskin is the layer of skin that covers the glans, which is the head of the penis, and blocks the flow of urine. Now that we know what is male circumcision and how does it look like, let's see what common questions related to circumcision do people have. Narin urologist Ulan Bolotovich is happy to answer and provide relevant information to some of them. Do medical experts advise circumcision or not?
So, if we talk purely in medical terms, then of course it is necessary because, firstly, it cleans, and secondly, it is prevention of diseases of the female genital organs, including cervical cancer and many others. Therefore, it is better to make circumcision.
Do all men need to be circumcised?
No, for example, Europeans, like many other people, are not circumcised, and it's totally fine. Here it is the matter of hygiene and care. Circumcision in Central Asia is more of a ritual than a medical procedure. Here it is believed that the circumcision person is cleaner. The uncircumcised men often have inflammation and deposits. A person should thoroughly rinse and dry his genitals every time, because after the act of urination, urine can accumulate there. There are cases of skin corrosion even. From hygienic point of view, it is better to be circumcised.
What is the most common person to do a circumcision procedure in Kyrgyzstan?
So, the most common person to do the operation in Kyrgyzstan is a medical expert, of course, who is well familiar with the human anatomy. Nevertheless, some people turn to religious figures such as Moldos to proceed with an operation. Moldos are very common in rural areas where you don't have the access to a proper medical help.
Is it common to get re-circumcised in Kyrgyzstan?
It is not a rare occasion when men come to us to be circumcised 2 or even more times. Most often these are patients who are over 50 and who have phimosis of the penis. So this is when the head of the penis is completely covered by the foreskin and the person cannot urinate. It turns out that if you are not circumcised in the youth, then in an older age you have to do it again. Some patients come and demonstrate the unfortunate consequences of the operation carried out by the so-called Moldos. Most often they do not cut off the foreskin completely. It seems that there was a circumcision, but there was only an incision that is slightly lowered. In such cases, the skin grows back together and the operation has to be repeated at a later age.
What is the best age to get the circumcision?
Oh, of course it is better to do it at a younger age. Firstly, the child does not remember the whole procedure. Secondly, as an adult, it can clash with an erection. When we circumcise, we sew up some areas. The stitches can break and move away during an erection, after which we have to sew back the torn area. The process is long. It is inconvenient for the patient and for us. When the procedure is done at a younger age, the healing process might take only about a week and everything is fine. At a later age, children are sensitive to this procedure. They come prepared for this pain, so the operation can be more difficult psychologically.
What is the best way to be circumcised?
Now we use the latest technology such as laser. Doctors often refer to it as a cold knife. The operation takes place in a more civilized and comfortable way for both patient and doctor. For doctors, it is more convenient to use a laser procedure. It is immediately coagulate the vessels and there is almost no bleeding and operation field is clean. It is used to be done by traditional methods, which could and still can lead to complication. But medicine does not stand still, and we are constantly improving.
How should I care for someone who was circumcised?
So, some of the recommendations are to have bath with a solution of potassium permanganate, a series of 1-2 times for 10 or 15 minutes, and use levemcol ointment 3 times a day. Also, within 5-7 days, try to eliminate traumatic factors as much as possible. You also should delimit child's physical activity for 5-7 days. And you have to understand that the suture material used during the circumcision procedure is self-absorbable, meaning that the sutures do not need to be removed.
What are the benefits of medically assessed circumcision?
Oh, there are many benefits such as better hygiene, decreased risk of urinary infection and sexually transmitted diseases, prevention of phimosis, and many other penile problems.
So what is your opinion on this peculiar operation?